Hello, my name is Natasha Cross, and I was asked to share my story about my family and my son. I'd like to start out by telling you a little bit about our family. I am 39 years old. My son Walter is 3.5. My husband is 42. We both were in a place in our lives where we didn't know if we were ever going to have children or not. I did have gastric bypass surgery. I was once close to 350 pounds, and not a year after the surgery, I did become pregnant, and I was very happy about it. My pregnancy was high risk because of my age and the gastric bypass surgery history. Things went fairly smoothly through the pregnancy. We did get a false positive on the amniocentesis, which was rather traumatic at the time, but through further monitoring, they ruled that out. Walter was born. The delivery was excellent, pretty easy. We stayed in the hospital for 3 days because I delivered so quickly. He and I don't have matching blood types, and we had to stay for the antibiotics and the medicine. Walter was excellent growing up as a baby. He was really easy. I had problems with breastfeeding, so I eventually pumped for 8 months and fed him breast milk in a bottle, supplemented with formula at times. Everything growing up, he was ahead of the milestones. For sitting up, rolling over, he walked at 10 months. I used to look at him and I essentially worried about autism just because of the prevalence, and you just don't know at this time if your child is going to be autistic or not. I know that boys had a higher percentage, and I know that we were older. So up until the first year when I looked at him, I would think, essentially, he's not showing any of the symptoms. He's very interactive. He looks at us, he laughs. He, is hitting all of those milestones correctly and ahead of schedule. At about a year old, I started to become concerned, or I was probably concerned a little bit before the year mark. I just noticed that he wasn't talking. He did say mama and dada, and then those slipped away, and he just wasn't talking. And there was a lot of frustration and tantrums in him starting to come out, and I could tell that he was frustrated. He was trying to communicate to us, and he was having trouble. Very smart though. He was always smart as a whip. Figured things out, just watching things one time and he could figure it out. At his doctor's appointment at a year, I told her that I was concerned. I told David prior to that I was concerned, and I might have mentioned it to family members, but I didn't get very positive responses. So I kept it to myself a lot in those early stages. So when we went to the doctor's appointment at a year old, the doctor didn't really see a problem. She's decided that some children talk later than others, and he did have that social aspect. He always looked at people and smiled and responded, and he is very social. So she made us wait. And during that time, I had extreme anxiety. I also felt angry. Nobody was hearing me. The doctor, I felt like she pushed aside my concerns, and almost like she thought that I was a little bit over concerned at that time. So I had to wait till his 18-month checkup. That's what she had told me, that we needed to wait until then so she could reevaluate it and give him a little bit more time. So the 18th-month checkup came, and I was still concerned, and we discussed it again. So at that time, she decided to go ahead and start the autism screening process. And just a little history for you. I am a registered veterinary technician, and I specialized in behavior and training. All my continuing education was in behavior modification. So I knew that there are critical windows of times in animals that you can't get back. And so from that 12 months to 18 months, I sat in anxiety, and I watched him and worried a lot about, was damage being done that couldn't be fixed. I wanted to start right away. So the 18-month mark came, and she decided that it was time to test him. So the autism screening process, I guess, starts out with the hearing test in most cases. So we had to schedule the hearing test, and it took a couple of months to get that scheduled. During that time, I just had a lot of anxiety with the worrying and the waiting. My husband, he was never really fazed or as concerned as I was during the process. So we went to our hearing test, and I really just thought it was a step in the process. I didn't ever think that he had any kind of a hearing problem. He responded to his name, he responded to noise. The only thing that I would tell the doctor is, it sounds like he's trying to talk, because I could hear the same like sing-song rhythms of phrases or words that we said, and I can hear like that, the rhythm, but the pronunciation just was not clear. But I never ever considered him to have a hearing problem. And we went into the booth, and he was a little over 18 months at this point, so they do it with speakers and little toys, and he sits on the lap, and he is supposed to look toward the direction of the sound, and then they reinforce it when he looks and try to build that up. And it became obvious to me that he was not looking to the left on quite a few of the sounds. And I sat there and probably I think I was a little bit in denial, a little bit in shock, but it was obvious to me that he just wasn't responding. And so the audiologist came in and discussed her findings. I'm probably going to cry during this. And I was, a little bit paralyzed. I did not know what to expect. I was confused and bewildered. and I had anxiety, but I thought at that point, okay, maybe this is it. Maybe this was the problem, and things were going to get better from here. Um, so then, once we had that diagnosis, the next step was for him to go under anesthesia with a head and neck surgeon and an audiologist, and they were going to do a bear test on him under anesthesia because of his age, to check and find out exactly what he could hear, because he couldn't tell us what he was hearing and what he wasn't. So I had to wait months for that again. During that time, I was pretty much a basket case. I was extremely anxious. I was anxious for him going under anesthesia, and I was anxious because I didn't know at that point. I didn't know what his life was going to be like. At that point, I knew that it was going to be different, and that it was going to be something we had to adjust to and learn about. But I just had a lot of anxiety, and I began to look back and reflect, and I remembered that when we were in the hospital and he had his hearing screen, it took an extremely long time. And so I made my husband go find them because it was supposed to be a quick thing. And so they came back in the room with him, and they told me that he failed in his ears, but they retested him. And so after testing him 3 times, they said he passed, and they just blamed it away on that his delivery was so quick that it didn't have time to push the fluid out of his ears. So they just thought he had fluid in his ears. So I started thinking about those things and thinking about that. And I had suspicions that maybe he was born that way. We did the bear test. I inquired about, needing blood work prior to, because in animals, we always check blood work, but I guess in children, they don't. So I had a lot of anxiety, but I trusted that they were going to do the best for him. So the day of his procedure, I was really angry. We had to wait. I was anxious. I was angry. And I was starting to feel like maybe, he slipped through the cracks a little bit. So we had that test, and I got the diagnosis of the neurosensory hearing loss. They couldn't tell me what caused it, and to this day, we still don't know if he can become completely deaf. He's bilateral, so he wears hearing aids in both ears, and he has to be tested every 6 months for his hearing to make sure that it's not progressing. We still don't know that he could eventually become completely deaf. So once I found out all that information, I think that I was overwhelmed. I dove into the world of hearing loss. We started having teachers come over through the county. We got signed up. He was about 2. He had a speech therapist, and he had like a form of OT, but they really didn't call that, but they worked on his motor skills because he was behind in the motor skills as well as the language after the hearing loss. And I did notice things start to progress and him to make progress. So I started to believe in my mind that he probably, maybe he wasn't autistic, and maybe it was just the hearing, and this is where we were going to be. And so we learned some sign language, and we taught him some sign language, and it seemed to really help with his frustrations, and things were looking pretty good for me. I think I had accepted that he was going to have hearing aids, and that wasn't such a big deal. I felt bad for him, that that he might possibly made fun of, and that he was going to look different with the hearing aids, but it was I was okay with it. I do have to say, though, in the beginning, I was in the grief cycle, I was in guilt. His type of hearing loss, they cannot ever tell me how he got it. It could be injury related, it could be sound trauma related, and so I felt extremely wrenched with guilt. I felt like something happened. He did fall at one point and it hit his head. Maybe it happened then. I just felt extreme guilt that this potentially was something that I could have prevented, or potentially something that I caused. I just kept going over everything that could have happened. I was stuck kind of in that guilt, I think. So then we still pursued the autism diagnosis, but I think I pushed it away in the back of my mind, and thought, this is probably hearing related. So we had to go and be evaluated. And I think, well, not I think, I know that they sort of were torn at the same kind of a situation, with the diagnosis of autism. He was social, he was responsive, but he still had a lot of trouble communicating and some motor skills. But motor skills can be affected with the hearing loss. So we had to wait, and we were tested, and they weren't sure, so they asked us to come back. So we had to wait a couple of more months, and then we had to go back. And we went back 3 times before she finally said, yes, we need to pursue the autism diagnosis even further, and then we have to go to Rancho Cordova for the autism test. So during that time, I had anxiety, and I think I had quite a bit of denial. I just really pushed it aside and was just dealing with the hearing issue, and I struggled a lot with him learning sign language, if that was the way we were going to communicate, or if we were going to communicate by speech. And I felt a lot of pressure. I wanted him to fit into the deaf hearing community, and I was just struggling to make the right decisions with him. So we had to wait months again to get that appointment, and when we went, I think I was in like a lot of denial. I was I was feeling numb. I just really wasn't feeling a whole lot, I don't think. So we went that day, and the test was during a time when he would have normally been napping, and his behavior was out of control. And I informed the people, taking the test, giving the test, that this wasn't a normal day for him. And I didn't feel like the test was very positive an experience. It lasted for about an hour and a half, 2 hours. And at this point, he had hearing deficits, and, his language was hard, still is hard for some people to understand. So I tried to translate a little bit during the test, and I was informed, to stay quiet. And I was only trying to tell them what words he was saying, because I could understand them. So at the end of it, we sat down, and they did diagnose him autistic. And at this point, they scheduled, the autism tested had changing. They didn't give it labels anymore, so they diagnosed him a level 2. I'm going to pause for just a moment. Okay, sorry about that. After the test, I was probably in complete denial. I couldn't think about it. It extremely, the moment I started to think about it, and it was like an overwhelming experience. So much was unknown. So much I didn't know. Would he be able to live on his own? Would he be able to function? I mean, I had no clue, and they gave us a lot of reading material, and I couldn't even bring myself to read it. I was that overwhelmed. It's like I put on blinders, and I could only focus on like our day-to-day living. If I opened that door and started thinking about all the possibilities, I just would become overcome. I was in a fog, and I was just hardly surviving almost in my mind. And after the diagnosis, when I went to tell my family and my friends, it was a big deal. My family, a lot of my family disagreed, and they didn't. I think that was their own form of denial, because again, my son is not like the typical. He's very social, and he's got a really good memory, and he's on a different side of the spectrum. And so my family had a really hard time believing it. And I was angry at my family, and I had to basically fight them, is what I felt, to believe it, and they would outrightly tell me that he's not. Even though I had a medical diagnosis, they would still tell me that he is not. And they really didn't like talking about it. And the same, on the other side of the family, there was a lot of denial. And it took a long time for some people to see. I also, a lot of changes occurred in my life during that time. I lost really my best friend. I don't know why, but some people would get angry at me when I told them, that Walter was autistic. And they thought I felt like they thought I wanted something wrong with him, or they thought that I was being like a hypochondriac, like that there was nothing wrong with him, and kids don't talk till late sometimes. And I just had to hear it so much. And, my friend would become visibly angry whenever we talked about it. And so I really felt like I didn't have any support. I really felt all alone. I felt overwhelmed. I was isolated. I was depressed. I was guilty. I was in denial. I had anxiety for the future. And I had a lot of anger. I mean, I just went through periods, where I would experience each of the stages of grief. I then, I questioned myself a lot. Maybe they're right. Maybe, I'm wrong, and maybe I'm, making something bigger than what it is. But I couldn't be, Why would I get a medical diagnosis if I was making it up? So I guess I started to accept it. I had a lot of anger at that point because I felt like he slipped through the cracks. I felt like he slipped through the cracks of his hearing, um, that initial hearing test. And then I felt like he slipped through the cracks with the amount of time that we had to wait. At 12 months old, I said that he was, I was worried he was autistic. And we didn't really get the official diagnosis till I believe he was after he was 2, so almost a year. No, excuse me. It was close to being 3. He got his hearing aids at about 2 years. So, um, before he ever started treatment, it took 2 years. It took 2 years. If you think about prior to that 12-month appointment, I had concerns. At that 12-month appointment, I told them, and then we were made to wait. And I just really feel like he slipped through the cracks, and especially with knowing about, development and behavior, I felt angry. I felt angry at myself sometimes because I didn't fight hard enough for him and that, I had failed him. Excuse me. I still deal with a lot of that anger and guilt. Um, After his diagnosis, we went around and interviewed the treatment centers. We did get him into a treatment center, and I was kind of like in Coast Automatic Drive. I was still couldn't really look outside of that little bubble. I could only think about what needed to be done to get through the day almost. I just couldn't. I was just paralyzed. I was in this fog. And I know that when the teachers came in, they probably thought that there was, a lot more I could be doing, but I was doing the best I could at that time with all of the things in life that we have to deal with. So we started him in the treatment program, and I was very open and trusting, and I thought, this is great. This is it. This is going to get taken care of, and everything's going to be great. And it wasn't long after that he started the treatment center that we did have some problems, he would go for different amounts of hours, and there were some problems with communication. There was some problems with, you know, communication binders not being filled out, and then also there was a point where he didn't get fed. He was there for over 4 hours, and at this point he was 2.5, and I would send food with him, and his communication binder wasn't getting filled out, and he wasn't getting fed. And so I brought it up, and I think that it's what kind of shook me awake and kind of took me out of that place of being paralyzed and feeling reliant on other people that were the experts. And I kind of started getting, shook up and thinking, how is this happening? And again, I really feel like he slipped through the cracks, even at this treatment center, because there were so many kids there and they were exchanging hands, and he had issues around his eating, and I really feel like communication was lost and he slipped through the cracks during that time. So it really threw me kind of into a tailspin again. I went right back into that guilt, that anger, And a lot of times the anger was directed toward myself, not feeling like I had done enough, not um, being able to protect him and being there for him. And so I think that's when my attitude really started to change. I became a little bit more forceful, a little bit more abrupt, and I think I stood up at that point, in my head and just was like, this is it. I cannot allow him to slip through the cracks any longer. That's what I felt was happening, and it was happening again. So, I just started fighting, fighting really hard. I had big meetings with Kaiser, I had big meetings with the company, and I wanted a change to take place, and it was a battle to allow that change to take place. I went all the way to the state of California and I filed complaints, and I was never going to stop. Um, I didn't care what it took. Like, I was going to get what I felt was right for my son. And we had a lot of problems, even while I was fighting, he was still going to that center, and we ended up bringing it into my home because I felt like I could no longer trust them to, have him at the center because I was afraid of him falling through the cracks. Excuse me. So he started receiving treatment at home. And it was awful. I have experience in dog training, so I know how important consistency is, and I know how important some of the things that they were doing were. But it came to the point where my son was crying till he was vomiting or gagging out of a 2.5 hour session for 30 to 45 minutes of it. I just couldn't. I just couldn't wrap my head around it, and that's a discussion for a later date. My feelings about the treatment of autism and things like that, and having my experience with animals for 15 years. But I just feel like I had to fight so hard. I had to fight. There were days that I spent hours on the phone on hold. I filed probably 18 to 20 formal complaints with Kaiser, and I had to jump through hoops. I had to sit on the phone. I had to go up a chain. I had to tell my story repeatedly to different people.